Up Close is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, Tennova.com.
Whether you know you have a few pounds to lose or you're super fit, the health of your heart isn't always easy to pinpoint. Some heart-healthy advice coming up next on Up Close. Thanks for joining us for this edition of Up Close. I'm Stephanie Aldrich. You may think you make healthy decisions most of the time, but even the most in-shape person may battle high cholesterol and put their heart under stress. So how do you cut through all the numbers and find the best approach, especially with some new FDA guidelines regarding cholesterol reduction drugs? We talked to Tennova cardiologist Dr. Kyle McCoy about those new guidelines, plus the lifestyle choices that help and those that could actually cause harm to your heart. We started our interview with just how much the way we treat and view heart attacks today has changed.
Because it has become so routine, people have become very blasé, and it wasn't that long ago that having a heart attack was a life-threatening illness that changed everything in their family. I have a patient whose husband had an MI in 1960. He was a physician. He was put at bed rest for 6 months, and there was no interaction. There was no way to help him. He laid in bed for 6 months, and when he got up, he had a blood clot in his leg that went to his lungs, and he died of the treatment for a heart attack. And that was only 50 years ago. Since then, a better understanding of what it is that causes the heart attack has come about. And then after 25 or 30 years of really heroic research and dedication, we found ways to make a heart attack almost a routine. You come in, you go home 2 days later, and you go back to work 2 weeks after that.
And when you think about the amount of bed rest that used to be recommended to this kind of being, hey, you're good to go home a couple of days later, that's a lot of research and a lot of learning that's happened in historically a relatively short period of time. Very short and dramatic in a lot of ways. There's been the research area where scientists have tried to figure out what it is that causes the heart attack. There have been public policy, things like the Surgeon General coming out with his warning against cigarette smoking, schools having education on health and mandatory health, and then there's been the educating the population so that they want to have their blood pressure treated, they want to have their cholesterol checked and evaluated. So it's not just the research front or the doctors or the scientists, but it's the whole U.S. population has put out an incredible effort to make what was the #1 killer almost a routine thing that you come in like you're getting a tooth pulled. Wow, and it's so amazing to think today that the recommendation was, and I guess it's understanding then that, okay, just take it easy, don't push yourself, but in fact, those kinds of approaches in fact made things worse, as you just kind of explained.
The word was convalescence, and you were almost expected to die of your heart attack. It was thought to be an inevitably fatal experience. So, okay, poor John had a heart attack, let's put him to rest. He's never going to work again, his life is over. And that was a common view in the 40s and 50s. As the 60s rolled around, we started having ICUs and CCUs. We could shock the heart. That became very helpful. And then EMS, which we take for granted now, became very common in most big cities. And so all of these efforts have led to patients having early detection and early treatment so that what it is that causes the MI is treated and they're home the next day.
Talking about the smoking habit alone, and you know, we hear about it for overall health for so many things, but just taking away the smoking habit, what kind of an impact does that really have on your heart, no matter how long you've been maybe doing it?
Well, quitting smoking has dramatic and positive benefits the day you quit. Nicotine causes an increase in your blood pressure, an increase in your heart rate, and decreases the tone of your vessels, so that by quitting smoking, you're better the next day. But over time, your risk of having a heart attack will decrease almost to the level where you've not smoked after about 5 or 7 years. I think smoking is a perfect example of this tremendous effort that was put into the coronary artery disease. In '66, we have the Surgeon General say it's a bad thing, it goes on the pack of cigarettes. There's still 50% of adults smoking cigarettes in 1971, so you could say after 4 or 5 years, it was a failed policy. But steadily, over the last 40 years, the smoking rate has gone down further and further and further to where now it's less than 20% of adults. And that, you can't estimate how big of an impact that's had on number of heart attacks, long-term benefits to blood pressure, number of strokes. So it's a broad swath that we've made here to try to improve things.
I want to talk a little bit too about the signs of a heart attack, and I think we've also learned more about those things over the years as well, and also maybe the differences, if there are differences between what men might see as signs and what women might see as signs. Can you talk a little bit about just the signs that should maybe set some alarm bells off for patients?
Well, the classic red fox is the pressure on the chest. But from that standpoint, most people are different. Everyone has their own signs. Some people will have jaw tightness. Some have had arm ache, back pain can be a sign, even nausea and vomiting without any chest pain whatsoever. And females will have non-chest pain causes, that would be their sign for a heart attack, probably a little bit more than men. So you have to look at the whole picture. I will say that people have become much more alert to the signs of a heart attack. It is an ominous feeling. They often know in the back of their mind that this is terrible. This is something way different than I've ever had before. So I had a patient who was watching a Vols game on the couch, and he had indigestion that was way different than anything else he'd ever had. He called paramedics 5 minutes later. They got there 3 minutes after that, and 8 minutes after his symptoms started, he had an EKG that showed he was having a heart attack.
But like you said, somebody might just kind of write it off as, oh, I'm having heartburn, or oh, I ate too much of the party foods here watching the ball game, or those kinds of things. It would be easy to dismiss it maybe sometimes.
It is. It is. And sometimes we'll do a heart catheterization on a patient. They will have never had any symptoms, and you'll find that they've had 2 or 3 heart attacks in the past and never came to seek medical attention. I think the index of suspicion is the key. If you have risk factors for heart disease, if you smoke, if you're the right age, if your cholesterol is elevated, diabetes certainly is a high risk, and you have symptoms that are new or different, especially if you're exerting yourself, you need to seek medical attention.
You were talking about some of the non-chest area signs for women. What should someone like myself pay attention to?
I would say it relates to what it is that you're doing when it occurs. So if you're exerting yourself, that would be more of a concern than if you're just sitting around watching television. So if you're walking up a steep hill and you get an ache in your elbow, or you get a tightness in your jaw, then I would be concerned, especially if it lasts 5 to 10 minutes and resolves on its own. So you get to the top of the hill, you take a break, it goes away, and then you keep your walk. That would be something I'd be concerned about, especially if you have risk factors for heart disease.
Okay, so even if you start feeling better, still pay attention to those kind of things. You were telling me too that not everyone has symptoms, and things can progress pretty quickly. I mean, you can go from having not so big blockage to something much more serious pretty fast. Can you tell me more about that?
Well, that's a good point, because we all know people who have had a stress test 1 week and the next week they end up with a heart attack and even die from that. That's part of the biology that the scientists have researched to come to a point where we understand what it is that causes the heart attack at that time, and it turns out it's a blood clot. So you may have a blockage of 20 or 30% and you don't really have any symptoms at all, and then the blockage will rupture, creates a nidus for a blood clot, and instantaneously you start having symptoms, and that's when your heart attack actually occurs. And most of the treatment that we have for heart attacks is to treat that blood clot, how to dissolve the clot, how to keep the vessel open so that the clot doesn't come back. And then that's why aspirin is so helpful, because it keeps you from having more blood clots.
We've talked a lot about the past and how we approach things different, and that, a heart attack you can, really recover from quickly and get back to your life, and just want to maybe be more aware of being healthier overall. But there's also been some recent news about statins, the drugs that people will sometimes take to address their cholesterol issues. And I understand there are some new guidelines. Can you tell us, compare kind of the old way of thinking with the new way and just kind of where you fall with these new FDA guidelines?
Well, statins have, most cardiologists would say that statins have changed their job irrevocably. The statin therapy has changed the disease process. If I have to choose two medicines for anybody with heart disease, it's going to be aspirin and a statin. And so as the last 30 years have come by, we've evolved to a point where we're much more sophisticated about treating patients who have high cholesterol. The latest guidelines don't change my practice plan very much at all. And the idea is that you divide patients into high risk of developing vascular disease and low risk of having vascular disease. And so if somebody is a diabetic and they smoke cigarettes, even if they've never had a heart attack, they need to be treated. So that would have been an expectation even before the new guidelines came out. I do think that it's great to have new guidelines because they bring the conversation out in the public and people can talk about it, and it makes it more timely. But in terms of treating patients with statins, I can't emphasize enough how important that is.
And basically the new guidelines are saying what exactly? Don't, I guess, linger around too much with a low dose, just go with a higher dose? Is that kind of what the approach is? Am I understanding that right?
That was their the initial thought.
Okay.
And then they came out with a clarification.
Okay.
And their clarification was, you know, once again, start low and try to find a 50% reduction in LDL. But I think what they were really trying to emphasize was less hang up on the number and more on risk factor modification and patient choice, so that you find patients that are appropriate. I would occasionally get a consult on a 35-year-old woman who is still having children who had a high regular total cholesterol, but everything else would be fine and they had no other risk factors for heart disease. Well, that's a low-risk patient. The reason for treating her with a statin the rest of her life would be inappropriate. Whereas I would maybe get a 40-year-old smoker who's never had a heart attack and they've got an elevated cholesterol and they've got diabetes and they're very sedentary. Well, that's a different patient even though they're similar age. And I think that's what I'm taking out of the new guidelines.
What are some of the side effects of taking a statin that maybe people might be hesitant and just question? Of course, as a doctor, you're always weighing the benefits versus the risk, and you're always going to look for what is the better scenario here.
Well, I think that's a good point because the risk-benefit ratio is what we always weigh. And in this particular scenario, people have started to understand that statin therapy is critically important. They don't want to have another heart attack, so they'll take their statin. 20 years ago, I think it was a little bit harder to sell. But
the alternative is not very fun, right?
Second heart attack, bad idea.
Right.
But I do think that there are symptoms that occur that patients sometimes or frequently don't even associate with the statins, and that's crippling arthritis or back pain, and to the point where they're totally inactive. I had a patient who had taken a statin for 10 years, never had a problem with it, and suddenly one day couldn't get out of the bed. He went through therapy for his back. He went to a CAT scan, an MRI, went to a surgeon who fortunately didn't want to do surgery on his spine. And after 3 months of progressive decline, I called my dad and said, stop your statin. And a week later, he was fine. So that hit home with me because it was my dad, but it also points out that you have to be diligent about seeing the side effects of the medications you're using.
Can someone be doing all the right things and, you know, they're not a smoker, they have a healthy lifestyle, they actually try to eat fish a couple of times a week and stay away from red meat, all those things that we hear all the time, and still have a hard time making a dent in that number? I've
had patients who can eat cardboard and they still have high cholesterol. When you're younger, it tends to be you can get away with it, and then there is some change as you get older to the point where your liver is just not going to process fats the same way. And so you can do everything right and you still have an elevated cholesterol, and you still need to consider therapy at that point.
But exercise does help your body just deal with that, in theory, you know, anyway, and so it should be a priority, I would imagine.
Active lifestyle So whether that means you park in the last parking spot or skip elevators or you know, volunteer to do extra leaf raking, whatever it might be, an active lifestyle is what I would try to consider, especially for patients over the age of 50. Exercise is great, but that's probably not as critical as an active lifestyle.
That's what I was going to ask you is, do you have to kill yourself in the gym and go to boot camp or train for a marathon to have an impact on your heart health?
No, you don't. In fact, it can be bad for people to have a sudden sedentary person decides that they're going to become an overnight Adonis. So I would encourage people to do what's reasonable. And when I go through the health club and I see patients who haven't worked out in years and they've got a personal trainer who is putting them through the ringers, I just cringe. Not just because of their cardiovascular risk, which is significant. And that's why they always put a little disclaimer at the bottom saying, talk to your physician and your physician should consider a stress test. But
we should actually pay attention to that.
Pay attention to that little letter, but also because they get injuries. And then when they get an injury, they get inactive, and then 6 months later they actually weigh more and they're less in shape than they were had they not gone through that. So what I emphasize is active lifestyle. That means push mowing your lawn. That means parking in the last parking spot. That means carrying your groceries rather than pushing the buggy. Little things can make a huge difference.
So there could be, I was just kind of curious on your opinion on this, is I think you're driving home just the overall, be active, do those little things like taking the stairs instead of the elevator, parking a little bit further away. So, if you've got two people, say one person who, maybe goes for a walk, does the yard work on their own, is chasing after children, is, maybe walking to pick up the kids from school and those kind of things. Those things, it sounds like, in your opinion, add up. And is it even better than, say, someone who, works all day at a desk and then, sweats out a few buckets in a killer spin class, but then they're done for the day? I mean, do both have some benefits? Or
both
just
have some benefits.
Yeah.
But they're slightly different. The benefits of physically demanding exercise might be as much emotional. Certainly fitness-wise, you'll improve more if you're taxing your heart at a certain level. But in terms of your overall health, those things that you can do every day, all your life long, are the best. So when you see somebody at church who's 80 years old and parking cars for everybody, he didn't get there at 80, he got there at 40 when he was doing all the active things that led to him being able to do that at 80. And I bet he never went to a spin class. You
were talking about, to the note of possibly pushing yourself too hard, you actually have a personal story about that. And a friend of yours, with fitness in mind, a very fit person. Tell me about that story about a friend of yours and training for a marathon and everything else.
I think the story is really relevant because you can't judge a book by its cover. A close friend of mine was a runner, very accomplished runner, very fit athlete. From the outside, you would never expect that he had any health problems whatsoever, and we were running a marathon when he had his heart stop. And so we did CPR and we were able to revive him, and fortunately he's not had any issues, and he's working and doing well now. But I think it speaks to the point that you do the extra exercise. You race bicycles, or you run marathons, or you climb mountains for reasons that are not necessarily just about your health, because you can get a health benefit from much more modest exertion than doing any of those things.
You had mentioned to me you also had a patient kind of on the other end of the spectrum to take some very modest approaches, and she was able to make great strides at even a later age in losing weight. Tell me what your recommendation was.
Well, this is a great story, Stephanie. I mean, she came to see me for high blood pressure. She didn't even have a heart attack or any coronary artery disease. She had been obese her entire life. She weighed 305 pounds, and we talked about her health to try to understand how to treat her high blood pressure. She had a lot of salt in her diet, and so I asked that she cut that out. But I also challenged her. I said, what do you like to do? And she said, I like to watch TV.
Maybe a little too much of it,
So
right?
I said, okay, let's do this. Let's take a negative and make it a positive. Every time there's a TV commercial, I want you to get out of the chair and I want you to walk. Just walk in place, TV commercial's over, you can sit back down. And she came back to see me 6 months. I didn't really notice. And she came back to see me 1 year after our initial visit, and she had lost 55 pounds.
That's significant.
And it was fantastic. And I just was in awe. And I said, "What did you do?" And she said, "I did what you told me to." And I said, "I don't remember what I told you to." She said, "You told me to walk during the TV commercials, cut out salt, and decrease my portion sizes." And she started to cry, and it was a wonderful experience. And she said she had been obese her whole life, and she couldn't get out of a chair because she didn't have legs that were strong enough to lift her out of the chair. And for the first time, she really could pop out of a chair and feel vibrant.
And so to that, can you reverse decades of bad health habits, or can you just help to improve it a little bit?
Well, you definitely can. A simple thing like cutting out salt can take away 2 blood pressure medicines. And we don't realize that only 5% of the salt that you eat is what you sprinkle. Most of the salt that you eat is in the foods that you choose. So hot dogs and cottage cheese and canned soups are going to be high in salt. You cut that sodium out of your diet, and all of a sudden your blood pressure is easier to control. You don't have that swelling at the end of the day in your ankles. And so little things can make a big difference, even if you've had decades of high sodium intake.
What advances and approaches are you most excited about right now as you're going forward? I mean, a lot of this advice is lifestyle, but are there some other things that are kind of on the edge right now that are making you excited about going forward with heart health?
Well, on the one hand is policy stuff. We've got to get this obesity epidemic under control, or we will not have enough money to pay for all the problems that are going to happen in 2030 and 2040 and 2050. From a technological standpoint, you know, the new science of how we remodel the heart after a heart attack, heart muscle has permanent damage after you have a heart attack. And so now new genetic opportunities for growing that muscle back and recreating a heart muscle. So no one needs a transplantation. No one needs a ventricular assist device because the muscle grows back. Now that's pretty mind-boggling stuff, but they've actually grown a new goat heart on scaffolding just by using all of the little chemical biomarkers that they know how to use. So the technology is out there, and within the next 5 or 10 years we may be able to say, okay, before you leave the hospital we're going to give you this little squirt of something and it's going to grow your heart muscle back. I'll see you in a month and we'll see how you're doing.
We wanted to talk a little bit more about Tenova's Chest Pain Center and the accreditation that it's received. Tell me about that honor, and then what does that mean for patients?
Well, Tennova is the only hospital between Chattanooga and Bristol that has a certified chest pain center. In order to do that, we had a 3-year process of self-evaluation, and it was fantastic, and we weren't real happy about it at the time. It made us say, what are the processes for taking care of patients with heart attacks, with chest pain in general, how long does it take? And by jumping through those hoops, in order to get a plaque, but more importantly to take better care of our patients, we got the accreditation. So we have a chest pain center where patients come in, they're triaged through the emergency room. If they're having a heart attack, they go to the cardiologist. If they have chest pain but it's not a heart attack, then the emergency room physician can differentiate between somebody who can go home and somebody who needs to be observed for a little while longer. Usually they get a stress test before they go home to make sure their heart's not involved, and it gives us a safety net so we don't miss somebody. The biggest fear is that somebody would come in, not have a heart attack, but have warning signs of a pending heart attack, and then you let them go home.
And then a week later.
And then a week later they have their heart attack, or the next day they have their heart attack. So the Chest Pain Center gives us a safety net. They come in, they get evaluated. If they're not having a heart attack, they can be placed in the Chest Pain Center. They get a stress test before they go home in a very expeditious manner. So within 24 hours, they get a checkup. They get a heart checkup while they're here. Just
as a physician, when you're thinking about people and their overall health and their heart health, is there a message that you just really want people to take to heart?
Your body is a hunter-gatherer body, and nobody's hunting and gathering much anymore. So
I'm hunting and gathering in the pantry or the refrigerator, right?
Yeah, or the channel changer. So if you can do little things that will take you from completely inactive to being more active, it can make a big difference. I'll give you an example. I got a lot of patients who have small yards, but they use a riding mower. In the 50s, nobody had a riding mower for those small yards. And so while it's great to be able to get on that rider and it feels good and it sounds great, but at the end of the day, it's bad for your health. Blowers, whatever happened to the rake? Just get a rake and start raking. And you know what? Besides just cleaning your yard up, you're giving yourself a workout. Pretty good stuff.
Yes, it is. Well, thank you so much for spending time with us and giving us a lot of great things to think about so we can just all be healthier. Thank you, Dr. McCoy.
Thank you, Stephanie.
Dr. McCoy says having AED devices in public places has also been extremely helpful for heart attack victims. The machine basically walks someone through the CPR steps to try and save someone's life. The Chest Pain Center at Tenova's Physicians Regional Medical Center in Knoxville has received special accreditation through the year 2015, the first East Tennessee hospital to receive it. Be sure and join us next week for another edition of Up Close. I'm Stephanie Aldrich.
Up Close is presented by Tennova Health, with 6 hospitals and more than 1,000 dedicated physicians. For more information, Tennova.com.